All right, we're going to go ahead and get started. So thank you all for joining us today for the South Texas Regional Family Medicine Grand Rounds. Next slide, please. Here is the code for today, so you can all claim your CME credit. I'll leave this up here for a little bit. All right, next slide, please. This is just information regarding the AAFP credit system. Next slide, please. And these are the core competencies of the Grand Rounds we'll address today. Next slide, please. And then here's a brief introduction from Dr. Shi.
Hello, thank you for attending today's Grand Rounds. It's my honor to introduce Dr. Mary Nguyen, who's a board-certified family physician and fellow of the FAAFP. She practices in Castroville, Texas since 2000. So she recently had earned her Master's of Science in Medical Cannabis Science and Therapeutics from University of Maryland, Baltimore, just this May. So it's very exciting. This is a new upcoming area, so we'll hear a lot more about what she had learned from this program. So Dr. Nguyen is an associate adjunct clinical professor in the Department of Family Medicine at UIW, and she regularly precepts medical students in her office, has done so for over 20 years. So she's also associate medical director for Companion Hospice, a member of the United Physicians of San Antonio, ACO. So she has served many leadership roles regionally, statewide, and nationally. So she's a member, past president, and past board chair of TAFP. So she has served on numerous TAFP committees and commissions. So at the national level, she has served as a member on the AAFP's Commission on Membership and Member Services. So serves as the AAFP convener for the Working Group on Rural Health. Served as a member constituency alternative and delegate on the AAFP Congress of Delegates, and serves as the AAFP representative for the American Academy of Pediatrics Advisory Group for supporting providers and families to access telehealth and distant care services for pediatric care. So she currently serves on the TMA Committee on Rural Health, Bexar County Medical Society Legislative and Socioeconomics Committee, as well as Public Health and Patient Advisory, so Patient Advocacy Committee. So she's also a member of the Society of Cannabis Clinicians and the Association of Cannabinoid Specialists. So without further ado, let's hear about the topic on cannabis and the law from Dr. Nguyen. Thank you.
Thanks for that nice introduction and for inviting me to speak today. And basically that my bio just basically means I don't know how to say no. But today we're going to talk about cannabis and the law. It's actually, this is a lecture that was created by my classmates and I for our capstone. We had 6 lectures that were 30 minutes long that we combined into 3 so that we could present to the TFP, so that the TAAP can use as a free service for its members. And before I start, I wanted to go over some important terms and definitions, because before I started studying cannabis, I got very confused with a lot of the terminology. There's a lot of slang and terms that get very, very confusing. So some basic terminology. Cannabinoids are molecules with activity at the cannabinoid receptors, and there's 3 classes of cannabinoids. There's phytocannabinoids, which are like what we normally hear, the THC and the CBD. There's the endocannabinoids, which are the cannabinoids that we produce naturally. There's 2 of them. There's the AEA and 2-AG, and then the synthetic ones, which are usually the drugs of abuse. Then there's the cannabis-based medications that are FDA approved to be used for seizure treatment. The synthetic ones are dronabinol and nabilone. I won't be talking about any of them, but if you happen to hear about them, that's what they are. And then there's plant-derived ones, which is epilodoxin, nablazoles. And then there's the cannabis products, and those you hear a lot about from patients, and those are the flowers, the concentrates, the tinctures, and the topicals, and the edibles. So I'll be talking about the phytocannabinoids today, which are the ones that we know most about, the THC and CBD. So a few years ago, FMX theme was your why, know your why. And why did I become interested in cannabis? And Jonathan is the reason. He's my youngest son. And if you look at the picture on the left, looks like a cute little kid graduating, basically kindergarten. He was graduating from kindergarten. And what you don't see in the picture is the fact that this child wore one shirt. It had to be a red short sleeve shirt and pull-on jeans. He hated anything with sleeves and anything on his head. So the fact that she was able to get him to dress and semi-smile in this picture was a massive improvement. And kudos to his therapist, because there was no way I could put him in anything that was not his red t-shirt. And I remember one day getting him ready for school and trying to put on a jacket for him. And after 45 minutes, and we were both frustrated and crying, and we just gave up. So the picture on the right was about 2 years ago. He was only 6'2" at the time. He's currently 6'5" and 18 years old. And you name it, he has been through every therapy possible: PT, OT, ST, play therapy, equine therapy, floor time therapy, swim therapy, music therapy. And he was doing fine. He was on one psychotropic when he was preteens. That really, really helped. And then once puberty started, that's when we had the most problems. He actually became violent. He wasn't sleeping. His psychiatrist and we worked on medications for him, and he was on enough tranquilizing medications to knock over an elephant and still wasn't sleeping. And after about 24 to 36 hours of not sleeping, his meds caused him, his seizure threshold to be lowered, and he actually had 2 seizures, which were very scary. So I asked the psychiatrist about starting him on CBD, which is legal in the US. And that worked for about a couple years. And then when he turned 16, the aggression was so severe that I actually was concerned about my health. His sister in the picture is 4'10" and about 100 pounds. So you can imagine a 6'5", about 200-pound child, because he functions about at a 7-year-old developmental age, come running towards you and pounding you on the chest. And we actually thought about possibly institutionalizing him and having him committed. And as a last resort, I did some research and talked to some other parents in a group that I belong to that have children on cannabis from different states. And I actually talked to a pediatrician who treats seizure disorder in California, and asked his psychiatrist how he felt about starting Jonathan on THC. And at that point, we had tried pretty much everything, and he was agreeable. And it has made life changes in both Jonathan's life as well as our own. He has still some meltdowns, which are controlled by his current medications. He takes quetiapine and duloxetine and an old benzodiazepam called chlorazepate, and he has clonazepam as needed for his anxiety. And I just filled his prescription, but the last time I filled it was 2022. So again, it has made a world of difference. He takes 5 milligrams of THC twice a day with 100 milligrams of CBD twice a day. And his psychiatrist and I meet on a regular basis to discuss his medications. And we haven't had to change medications on him since he started the THC in combination with his CBD. So the first section, I'm going to credit one of my classmates, William, who helped put this part together. And this part talks more about the Controlled Substance Act. So we're going to examine the historical use of cannabis as medicine in the US and why exactly it was targeted by politicians with the Controlled Substance Act, or the CSA. We're going to talk about the use of cannabis in consumer products before anti-cannabis legislation, explain the definitive reasoning for the creation of the CSA per the Nixon administration, And by the end of this lesson, you should be able to answer, was cannabis ever included in the USP or the United States Pharmacopoeia as a prescription medication? What major prejudicial strategies did President Nixon and Mr. Erkman utilize to incite negative public opinion on the use of cannabis? And which two groups did President Nixon and Mr. Erkman want to outlaw, but were not able to? What was their alternative strategy? Did any accredited medical entities oppose its criminalization, and why? So, as with all CME questions, all medical and academic entities and affiliated individuals unanimously found that cannabis was harmful to the individual and the public, and found that there was absolutely no medical use for cannabis. And the answer to this is false. So what Will likes to call the great dupe was that a direct quote from the US government to 2018, when asked, did we know we were lying about the drugs? Of course we did. And that was from President Nixon's aide, John Erkman. For the 115th Congress, which was a 2-day session, the resolution 933 said that the war on drugs was admitted to be a move by the Nixon administration to attack his political opponents, arrest and manipulate specific groups. Mr. Erkman verbatim stated, "We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news." And this is, again, a direct quote from US government 2018. So what two prejudicial strategies did Nixon and Mr. Erkman use to sway public opinion in favor of cannabis prohibition? Facts and logic, evidence-based medicine findings, racism and xenophobia, or sexism and ageism? And the correct answer is racism and xenophobia. So before the prohibition, cannabis was used widely for a range of symptoms and illnesses prior to the 20th century as a patent medicine and in traditional preparations around the globe. It was included in USP from 1850 up until 1942, used mostly for insomnia, anxiety, but it was said to be used as an antibacterial, anti-inflammatory, but again, mostly used for insomnia as well as anxiety are the most common uses. And as you can see from the picture, these are pictures of how it was formulated. Merriam-Webster's definition notes that a patent medicine is often used to refer to a product such as an elixir, tonic, or liniment that was marketed as a medicine in the US during the 1800s and early 1900s, but was typically unproven effectiveness and questionable safety. So a lot of times this was just sold over the counter as a tonic or an elixir for a variety of ailments. In 1937, the Marijuana Tax Act came into fruition, and it was leveled by the federal restrictions on cannabis use and sale, and it was precipitated by repeated and continued efforts to paint the US Black and Mexican populations as dangerous, out of control, and under the influence of marijuana. And for some reason, President Nixon had a bias against the Mexican populations, and cannabis was grown mostly in Mexico at that time, and so his administration associated the Mexican population with cannabis use. The MTA, or the Marijuana Tax Act, was initially intended to regulate the importation, cultivation, possession, and or distribution of marijuana. And then also President Nixon had lots of pressure from high profile and wealthy business interests such as Rockefeller and Mellon, who wanted to promote their own products for profits in lieu of the hemp-based products, which were cheaper and the raw materials were more abundant. The bottom line was that xenophobia and racism were some of the main driving forces in the timeline of cannabis prohibition. The events and legislature leading up to the formation of the CSA was not unanimously in support of the prohibition of cannabis. Medically accredited entities and individuals voice opposition as well. So in 1938, the New York mayor, Fiorello LaGuardia, commissioned the New York Academy of Medicine to investigate the effects of cannabis use. And this was in a direct response to the Marijuana Tax Act that was leveled in New York. And staff of the clinical study included clinicians, psychiatrists, psychologists, accredited PhD researchers. So this was a science-based study or report and was presented. And the conclusions of the report did not find that the uses of cannabis cause violent, heinous crime, aggressive mania, or hemp drug insanity, as Anslinger asserted in his response. And I don't know if you've ever heard of a movie called Reefer Madness, which was made in 1936 and shown in the 60s and 70s. And this is actually, if you ever watch it, it's quite comical because of the extreme it went to show that marijuana was such a terrible drug. There was a bunch of well-dressed young adults who were sold, there was a party, they were sold marijuana, and even with one inhalation became basically crazy. One tried to rape a young lady, one murdered another young person, and one was committed to an asylum. So it basically said hemp or marijuana is a dangerous drug and would cause you to go crazy and commit severe crimes. There was one really interesting scene of a young lady who had one inhalation and started playing the piano like crazy, just repeatedly over and over and over very quickly. So addictive behavior. And that's what most of the population knew about marijuana at the time. In contrast to much of the messaging from the ongoing drug war, the LaGuardia Commission found that much of the intensive warnings about the gateway hypothesis held little reputability, and such that the instances are extremely rare where the habit of marijuana smoking is associated with addiction to these other narcotics. And again, marijuana, even today, is known as a gateway drug, but is not correct. And actually, I was just talking to my sister-in-law not that long ago, and she was very upset by the fact that I was getting my master's degree in medical cannabis, because she said, well, don't you know that marijuana is a gateway drug? And being a scientist, I said, well, could you show me some data, information, scientific proven information that states this? And she says, no, everybody knows it. So again, a lot of what we know about cannabis is by hearsay or anecdotal. And this is the reference to the first part of the lecture. The second part, we're going to talk about the Texas and federal cannabis laws. And the lesson objectives for this part is to restate the core mission of the CURT program, which is the Compassionate Use Registry of Texas, and list of qualifying conditions that eligible citizens of Texas would be able to leverage to obtain medical cannabis products in the CURT program. Restate the process by which eligible Texas patients would be able to obtain medical cannabis products. So again, the reason I got interested in cannabis is my son, who has autism. And just so you have an idea of the numbers of autism in the US, there's approximately, there's over 5 million adults that have autism in the US, which is 2.21% of the population. According to the CDC, there are over 75 million, or 1% of the US population with autism in the world. So I know you have probably seen a patient with autism, know somebody has autism. I think everybody's lives have been touched by autism, and these parents just have nowhere to go, and conventional medicine has worked for many of them, but have failed many of them as well. So the Controlled Substance Act classifies all medications and substances into 5 schedules, as we know, from 1 to 5. And of course, the Schedule 1 drugs have high potency for abuse. They have no medical value in the US. there's a lack of accepted safety for the use of drug or substance under medical supervision. And marijuana, which has tetrahydrocannabinol, known as THC or delta-9 THC, which is the chemical term, with a content of more than 0.3% of THC is illegal in Texas as well as federally. Marijuana is in the same class as heroin, LSD, and methamphetamines. Why 0.3%? No one really knows. There's no scientific data that states 0.3% is causes anything. It was sort of a random number that seems to have been created by the government to use as legal standards for THC content of cannabis. So again, I tried looking it up everywhere, and the only information I got was it was a random number that the government hoped would not cause any psychotropic effects. The U.S. Department of Health and Human Services, not last week, but probably about a month or so ago, I'm sorry, this is an old slide, sent the U.S. Drug Enforcement Agency a recommendation to reclassify marijuana from a Schedule I to a Schedule III drug, and that would be a major shift in the U.S. federal drug policy. If this gets enacted, marijuana use would still be illegal at the federal level. So moving of a medication or a drug from a Schedule I to Schedule III does not automatically make it legal. But the reclassification would free up funding for research, because most research that we have, as you can imagine, is very difficult to do randomized controlled studies on an illegal drug in the US or anywhere else. But it would allow us to at least do human health effects that would expand access to medicinal use, and then would also allow state-regulated medical marijuana industry operators to write off standard expenses and lower their tax burden. Currently, if you have a dispensary and you prescribe cannabis or of any type, be it hemp or CBD or THC, it is very difficult to find funding, because any bank that has FDIC insurance cannot be allowed to take your money or loan you money. So a lot of times these companies have to go to small local banks, which then charge higher fees, higher interest rates. And so it's very difficult to open a reputable business, even though I know you've probably seen a ton of them all over San Antonio. I think there's one on every corner. But again, they're usually small. They have very limited amount of cannabis, and I have no idea how they're made. As you know, patients are told, ask your doctor before you start this. So I have patients coming in with a vial and say, what is this? And can I take it with my other medicines? And a lot of the time the labels are not very clear. They got it from, I don't know, a gas station, and I'm supposed to determine if it's safe or not, which is very difficult to do, because again, I don't know how it's processed. I don't know how it was created. I don't know what's put in it. And studies have shown that sometimes the compounds have heavy metals and formaldehyde that's mixed into the substances. Recreation marijuana is illegal federally as well as in Texas. There are a few states that have passed laws that have allowed recreational marijuana. The federal government does not recognize the medical or recreational use of cannabis, and the medication that is approved by the U.S. Food and Drug Administration is Epilodox, which is used for treating seizures, genetic seizures. And delta-8 is a psychoactive substance produced from cannabis, and the status is unclear. It has THC, but it's supposed to be less than the 0.3%, but it is unclear how much is actually in it per se. And so some state regulators are trying to make it illegal. Currently, it is legal, but there's a really fine line on what is in it and where it can be used. So medical cannabis and hemp are the same, and that's false. So hemp is derived from CBD oil with less than 0.3% or less THC, which is then legal in the US. Businesses can sell CBD in Texas if it contains, of course, less than 0.3% of THC. I don't know how it's tested. I don't know if the DEA comes in and randomly tests, because again, there's not much regulation on CBD being sold in the US and of course in Texas. And that's why, again, you see them at gas stations, you see them at every corner. So hemp will be legal if and only if that hemp is produced in a manner consistent with the 2018 Farm Bill, associated federal regulations and association state regulations, and by a licensed grower. Again, CBD is derived from the cannabis plant without the psychoactive properties of THC. And then the Epidiolex is the only CBD treatment that's been approved by the USDA for treating seizures that's related to a rare genetic disease. And the DEA has approved 3 products that contain synthetic THC and THC-like chemicals, Marinol, Cypridus, and Cessinet. And again, Delta-8 is produced in small amounts from the cannabis plant. It has low THC concentration. It was able to be sold in Texas in 2021, and the Texas State Department of Health Services attempt to classify it as an illegal substance, but a district judge ruled that the DSHS can't enforce making Delta-8 an illegal drug, but there's no final court date yet. So again, you'll hear patients talk about Delta-8. It's kind of on the fence of legality, plus or minus. So I don't know if a patient is stopped and is in possession of Delta-8. I think it really just depends on the officer that happens to be stopping the patient to determine if this is legal or not. So my general recommendation is not to use Delta-8. And again, I don't know how it's produced and how much true THC is in it. The 2024 Farm Bill passed committee, and the 2018 Farm Bill expires this year in September. The new Farm Bill will close the loophole of legalizing intoxicating hemp products like Delta-8. So the new 2024 Farm Bill will make Delta-8 illegal. The Senate hasn't released their full version, so we're still waiting for that. And since the 2018 expires in September of this year, President Biden signed into law HR 6363 November of 2023 in the Further Continuing Appropriations and Other Extensions Act of 2024, which extended the Agriculture Improvement Act of 2018, more commonly known as the 2018 Farm Bill. And this allows authorized programs to continue until September 30th, 2024. Currently, the DEA is accepting written testimony on rescheduling of cannabis, but I don't know when that will be finalized. And so I'm not sure what's going to happen on September 30th when it comes to cannabis. Basically, and I don't know if you've ever read bills or legal writings, but they're so confusing and there's so many nuances in it. But so far, CBD is still legal and everything else is illegal with that 0.3% is what I've been able to read so far from the 2024 House bill. So can minors participate in the Texas Compassionate Use Program? And the answer to that is yes, they are. So it's true. The Compassionate Use Registry of Texas allows physicians to register to prescribe low THC cannabis. So I think you might have heard about some states have what's known as the marijuana card. We don't have that in the state of Texas, and patients don't register for the CURT program. It's an online system that's available 24/7, administered by the Department of Public Safety. So it's available for DPS, so that if somebody's on medical cannabis and is stopped by an officer with cannabis in their possession, with THC in their possession, the DPS site is available and the officer can look up the patient online, which then again is accessible 24/7. So Texas does allow medical marijuana except for cases that fall into the compassionate use law, and it allows doctors to prescribe low-dose THC cannabis containing no more than 1% of THC. Why 1%? 1% is considered the cutoff of possible psychedelic effects. And again, we're not really sure where the 1% came from. It's just considered the threshold for cannabis to have to not have psychotropic or intoxicating offense. And of course, everyone's different. So there's really no true scientific basis of this 1% dosing. The state legal cannabis programs are still illegal under federal law. So of course you can't cross state lines. So what happens if you have CBD, which is federally legal? Can you then cross state lines with CBD? No, you can't, because that would be interstate trade, or which the federal government controls. And since CBD is not truly FDA approved, there's no standardization for it. You cannot cross state lines with CBD. And as you can imagine, how difficult that would be for families who have children, family members who are on cannabis, either for autism or cancer or any of the regulated conditions. Being able to travel is always a challenge for these families. Federal law prevents the distribution of marijuana to minors. And so under Texas law, which allows minors to participate and receive medical cannabis if they have a guardian. So how does this impact physicians? Federal law prohibits the recommendation and prescription of marijuana. So even in Texas, it's called a prescription, but it's really not a prescription because it's federally illegal. So what we can do is we can recommend it to patients who qualify. So Texas and the federal government allow the use of CBD or hemp, again, with that less than 0.3%, but cannot cross state lines. Texas allows physicians to apply for the compassionate use program to prescribe medical marijuana to patients of all ages. So again, underage individuals can be prescribed or recommended medical cannabis if they have a legal guardian who's a resident of Texas. Again, the patient cannot take it across state lines, and the Texas Department of Public Safety operates and oversees the CURT program in Texas. Therefore, all information that concerns prescribing and oversight is done by DPS. There are approximately 57 certified physicians in the state of Texas that can prescribe or recommend legal cannabis. The Compassionate Use Act was enacted in Texas legislature in 2015, and DPS administers it, and they have a working group called the TCUP working group, and TCUP stands for Texas Compassionate Use Program. It has, I believe, 3 physicians. There's, I think, a total of 12 members on there. Currently, there are 3 open spots, but trying to get information about TCUP through DPS is almost impossible. There's one person that oversees it, and I've been emailing her for probably 6 months now, and I think she's written me back once to say they're out of session and she will get back to me in session when they go back to session. Their sessions are closed to the public, and after they meet, they then will report to the public any changes. There are, like I said, 3 spots that are open, and trying to find out how to serve on TCUP has been extremely difficult. So it's a very close group, and it's very difficult to get any information out of them. So qualifications to be a CURT prescriber: only a physician qualified with respect to a patient's particular medical condition, as stated, can treat for applicable medical conditions, and a physician is qualified to prescribe or recommend low THC cannabis with respect to a patient's particular medical condition if the physician is licensed under this subtitle, is board certified in a medical specialty relevant to the treatment of the patient's particular medical condition by a specialty board like the American Board of Medical Specialties or the Bureau of Osteopathic Specialists, and dedicates a significant portion of clinical practice to evaluation and treatment of a patient's particular medical condition. And again, I tried to contact DPS to figure out exactly what this all means. And basically, you have to be board certified. And I don't know what a significant portion means because my son's psychiatrist was not able to get certified when he applied, but I was able to get certified. So I honestly have no idea what that significant portion means. And my son's adolescent psychiatrist is actually the medical director for Clarity Hospital. So I try to get specifics, and I couldn't get any specifics on how you would qualify. You basically just have to hope you can get qualified by applying. So which of these diagnoses does not qualify for medical cannabis treatment? Seizure disorder, autism spectrum disorder, generalized anxiety disorder, and terminal cancer. And it's generalized anxiety disorder, which is contrary to popular belief because most of my patients who do use cannabis before they even come to see me use it specifically to treat their anxiety disorder. So again, a physician described by section 169.002, which is what we just went over, can prescribe low-dose cannabis to a patient if the patient is a permanent resident of the state of Texas, so they have to prove they're a permanent resident. The physician complies with registration requirements, and the patient is diagnosed with either epilepsy, PTSD, which was recently just added and was after lots of work by the VA, seizure disorder, multiple sclerosis, spasticity, ALS, autism, or terminal cancer, or an incurable neurodegenerative disease. And it's up to the physician to determine if a patient qualifies with any of these diagnoses. And DPS does not come back and review it. They basically just wants to know that the physician has looked at the list and that the patient actually qualifies with one of these diagnoses. And then, of course, benefit versus risk. The physician determines if the low THC cannabis is reasonable in light of potential benefit for the patient. And this is the web page that you can go on to look up the CURT program and the qualifications, as well as apply for the CURT program as a prescriber, or look up physicians that are certified under the CURT program. So what do you do next when you get a patient who comes in asking for advice? Again, go to the CURT website and find a CURT physician. There's 3 presentations to that are, again, the TFP has. So if you're interested in learning more about the endocannabinoid system, terpenes, how to prescribe, the TFP has those presentations. And then you can also contact a graduate of the Medical Cannabis Science and Therapeutic Program for advice. So just to give you an example of how this occurs in the state of Texas, and it's not a very good program. I had a patient who had a neurodegenerative disorder come in, and she brought me a bottle of her 1% THC and said she went online and had a telemedicine visit, and it's not covered by insurance. So she paid $200 out of pocket for the visit. And she was told, take this, start out at 0.5 mLs, take it till you feel better. And I said, I'm sorry, what? And she said, he told me to take it until I felt better. And I was so confused because I couldn't really ask questions and I really couldn't contact him afterwards. I have a 3-month follow-up, but I don't know what that means. And she was on Vyvanse, and she's also with her pain management doctor on ketamine infusions. So I spent about 30 minutes talking to her about it as well and asked her, so you had to pay for the doctor. Did this cover your cannabis as well? And she said, no. And just to give you an idea, 1 ml is $60 cash. And so she paid $260 to get a medication and was not properly educated on how to take it, which was very scary for her as well as myself. Because I asked her, did this doctor not know you were on ketamine? And she said, he just said, I have your records. I looked at them. And yes, you have a neurodegenerative disorder. And so you qualify. And so it's different for every patient. Just start out at this dose and just increase it. And I asked her, well, do you take it once a day, twice a day, 3 times a day? And she said, I don't know. He just said to start out with the 0.5 ml and then increase it as I saw fit. And she's not the only one who has presented to my office with stories like this. Also, there's only 3 dispensaries in the state of Texas that has medical cannabis. And Texas is a vertical state. And what that means is in order to get licensed to have a dispensary, again, there's no tax deductions or tax assistance. So it's extremely expensive. You have to grow cannabis. You have to then produce it and then package it and show the government how you did it with what's included, the terpenes, which are what give the cannabis its flavor and its taste, which is in the plant. There's different terpenes that can be stimulating or relaxing. And you have to store it in the same place overnight. It cannot be stored in any other place besides the facility. So you have one facility, and the way it works in San Antonio, which is of course where we are, is there's a dispensary in Austin. They have to drive it to San Antonio on particular days. You can pick it up between 10 and 2 and Tuesday, and sometimes they'll have it on a Friday. Because it's federally illegal, you cannot pay for it with a credit card. It has to be cash or check. And then they give it to you, and then you take it home. And then there's a person who then drives the medication back to Austin that evening. If you look online, you can also see different, and I have yet to find somebody who sees patients in person. Everything's done through telemedicine now. So you pay, and I've looked at a few sites. The ongoing rate is $200 out of pocket to see a physician to then get prescribed cannabis. And so the physician enters the patient's information into the CURT program with all the demographics and the dosing. And then the patient goes and it takes about 24 hours for DPS to get the information. The patient then calls a dispensary of their choice and then figures out when to pick it up. The prescription is basically just bottles. So you buy the bottle. There are no instructions on the bottle. It tells you it's 1% THC, mixed in MCT or an oil component, and no other instructions on the bottle. So that's extremely frustrating for patients. I currently prescribe medical cannabis for only my patients. I don't charge them any extra. It's just part of their exam. And the way I approach my patients for cannabis is if they have a condition that I feel would benefit and they're already taking conventional medicine but need more assistance. And then, I treat, because I'm in a rural area and I have an autistic child and belong to support groups, I tend to treat quite a few autistic individuals. And so I have a lot of parents who come in who have seen neurologists and psychiatrists, and a lot of the medicines that we use today are very sedating, and these children are in school and therapies, and they can't function sometimes on these medications, or they have different reactions. So there's 3 psychotropics that have been FDA approved to treat anxiety or agitation in autism. But if you look at the research, there's not much research. So they're FDA approved, but the research says they may help, but the side effects are pretty severe. And then we're talking about children of all age groups. And so a lot of them can't swallow pills, and a lot of these medications only come in pill form, whereas medical cannabis comes in gummy bears, which I'm not a big fan of because they're high in sugar, but tinctures, which then can be put in capsules to give to adults who prefer capsules, or be mixed in foods, usually a high fatty food for better absorption. And so I usually counsel and then recommend cannabis, and then I see the patients on a regular basis. And then I'm also on call 24/7 for my patients actually for all my patients, so that if they ever have questions, again, I'm easily accessible because I know it's very scary. And again, helping them with out-of-state travel is another challenge. It's been very frustrating for my cancer patients who are on cannabis for pain to travel, because then I'm trying to find places for them to get their cannabis, trying to find physicians. And that's why I belong to two different organizations of providers, because they're also nurse practitioners and pharmacists on these organizations to help patients to be able to get certified cannabis when they travel. I've had college students who have problems who are on CBD, who use it to help them with their anxiety, even though it's not indicated, but anxiety. And again, once they move out of state, I can try to do telemedicine visits, and we try to research places for them to go and get medical cannabis or CBD in order to help them with their situation. This was my capstone group. They are very open. Courtney is a physical therapist. Tess works in a cannabis shop. She does a lot of terpene education, as well as cannabis education. Angela is a retired pharmacist, and Will also has a business. If you're interested, he has an online advice counseling site that he's willing to give for free for the first visit. And I'm happy to share that if you just send me an email, or you can email him, and he's happy to talk to anybody. And again, my classmates are happy to consult anyone on cannabis and medical cannabis, and they're all, again, graduates of the University of Maryland MCST program. And these are my references. So let me get out of this. I think we have some time for some questions, if anybody has any.
Dr. Nguyen, I have a quick question.
Yes, ma'am.
So the CURT program for a provider to be certified, is there any training involved? That I'm just wondering the process is.
None at all. And again, I tried contacting DPS to see if they could give me more specific guidelines, and there's no training involved with it at all. That's why, like I said, my patient who got her prescription, I don't know what kind of training this physician had at all. And again, she was extremely confused. So my 15-minute appointment became a 45-minute appointment with me discussing how to use her medical cannabis. So there's no training. Basically, it's a crapshoot. You basically sign up for it, and I have no idea how they determine if you qualify or not. It's very vague.
Mhm. I think you mentioned 3 dispensaries in Texas. The one in Austin, where are the other 2 located?
They're around Texas. I can't remember exactly where they're located. But the Texas Originals is the one in Austin, and it's the one that we use to get medical cannabis for my son. They actually opened a location in San Antonio. So there's one in San Antonio, and they also drive to the major cities in Texas. So they also will transport it to Dallas, Houston. They have a list and a schedule. If you order more than $200 worth and you don't have somebody that can drive there to pick it up, they can mail it to you, but you have to actually talk to them first to determine if you're a candidate to have it mailed. But I've had it delivered before when I wasn't able to, because of course, 10 to 2, I'm in clinic, and it's hard to find somebody to go pick it up because they have to be listed as a guardian on the CURT site to pick up the medication. So they try. It's a lot better than it was when Jonathan first started, though.
I have a question.
Yes.
What would you say to a person who's interested, but who is a chronic user of either marijuana or Delta-8 on their own already?
So I have quite a few patients who already use it. I, of course, tell them about the legal implications about it, because smoking or vaping is illegal federally, and so Texas has made it illegal as well. So I tell them, so just so you know, I can't promote this, and but I can tell you about CBD and tincture. And of course, again, Delta 8 is an unknown entity in the sense that we don't know how it's processed. And I try to get them to tell me how much they're taking. If I can get a milligram dose of THC in the CBD, which helps a lot of times with the psychotropic effects of THC, I try to get them to add CBD to their Delta 8 when they're using it. And I ask them if they can bring it to me. So, and again, but it's really hard because I don't know where some of them get them. And for some reason, a lot of labeling are scratched out. And I don't know if the dispensary is doing that on purpose so patients can't read them, but it's hard to know what's in them. So I try to tell them to use the least amount. Try to tell them to take it an hour before or after their other medications, so there's less interactions, and then to take it with a fatty meal because it's a lipophilic component, so it tends to work better, and it also helps with the taste because there's different flavors, and honestly, they all smell terrible to me. And of course, with my license, I've never tried any cannabis products, but I just know when I have to mix it for my son, it just smells terrible. It's a very I've been told it's a very woodsy type of flavor, even if you try to put other flavors in it. And that's why a lot of people like the gummies. But again, I don't know how well people say, I take a quarter of a gummy or half a gummy, and I don't know again how much is in it. And then there's a lot of sugar and syrup that's used to produce a gummy. And so I don't know if it floats on top, bottom, where the THC is. So I tell people, if you're going to use a gummy, then please take the whole gummy. Otherwise, we have no earthly idea of what you're taking, how much you're taking. I'm sorry, it's not very specific, but again, when something's illegal or not measured, it's hard to give advice.
Right, no, that was really helpful.
Thanks. Any other questions? And again,
Dr. Nguyen,
yes, ma'am.
quick question about, I guess these type of visits and prescription, I would imagine not covered by any insurance or payer. But what are the typical costs? And I think you kind of touched upon, but trying to get an idea.
I bill it with just as, you know, the 99214, 99213 visit. So as a courtesy for my patients, I just bill it along with their follow-up appointments. But the going rate that I just looked it up, I think 2 nights ago, was $200 for an initial evaluation. And then looking up at the 3 dispensaries, the last time I looked, they were all about the same price. About 1 ounce is $60 for 1 ounce. So depending on how much you have to use, and most of the time, since THC and CBD has a half-life of about anywhere between 4 to 8 hours, usually 1 bottle may last a month. So $200 plus is $60. And then I don't know how much they charge for follow-up appointments, but I think some of the follow-up appointments are still in the hundreds of dollars, and again, out of pocket. So I have some patients who take it for the 3 months, and then they don't do follow-ups because it's too expensive and they just can't afford it. So that makes it very difficult.
Thank you.
Sure. And of course, my email is on the slides. Please feel free to email me at any time with any questions, or if your patients just show up and you're just like, okay, they're already taking this. What do I do now with the medications that they're on? So I've was able to get a patient off hydrocodone after 15 years. We tried to wean him down and he just couldn't. He went to 2 a day of hydrocodone, 10 milligrams, and he also had seizure disorder. So his neurologist put him on an anti-seizure medication, and pain management tried to put him on Oxycontin instead of hydrocodone, and he couldn't tolerate that. So I was able to wean him down from 6 a day to 4 a day to 2 a day, and then convert him to cannabis. And he takes 15 milligrams with CBD 3 times a day and says he's never felt better. So I asked him if he got the high, and I don't usually use doses. You usually have to do 30 milligrams up, and then the CBD kind of helps with the high as well as that. So I've been able to stop his seizures and also take him off hydrocodone with cannabis. So, and then I see a lot of, again, autistic individuals whose parents are just at their wits' end. I mean, high doses of psychotropics and benzodiazepam, and I don't take them off of anything. I add it on. And of course, I always tell them, please make sure you talk to the prescriber first they know that you're on cannabis. And then and of course, the rule is start low and go slow. So for autistic individuals, I start a higher dose because the endocannabinoid system is usually very subdued. And so they react better to higher doses, and I tend to titrate faster for my autistic individuals. Any other questions? Yeah, I think we have 5 minutes if anybody has questions, but I'm going to stop sharing my screen here.
So Dr. Wen, I think this is what I've imagined from your information sharing. On the CURT website, they will have all the providers who are certified listed there, right? If there were some patients who might be a candidate, I can look up the provider list, think about referral.
So you would
how
look
you
at
would go about.
Yeah, I would look at the CURT site and look at the referral. I'm not listed on the CURT site because I didn't want to be classified as a marijuana doctor because again, I'm doing this for my patients because I'm in a rural underserved area. So I know most of them cannot afford the $200 to go see a physician for this. And so you would go to the CURT site and then you would just look for a list of providers. And, I can also do that. So I'm happy to see any of your patients. And of course, they'd have to go through, the new patient information and get registered. And of course, I'm a family physician first. So I manage patients on all those ranges of medical conditions, chronic medical conditions, and then cannabis as a supplement for patients that I think are appropriate. And not all patients are. I have a lot of patients that ask me, and I've had to talk to them and say, no, you're not a candidate. It's not legal for this. And everybody wants it for anxiety. But then I usually try to get them to use CBD first to see if that's helpful because CBD is more indicated. The studies show CBD is better for anxiety than THC because THC actually at higher doses causes anxiety. So it just depends on the patient. As with, with everything else, I'm trying to figure out a regimen that works best for the patient. That's, of course, easy to give or able to give because some of them need it 3 times a day and you can't give it at school. So I actually have some moms who go to their child's school to give them their cannabis in the middle of the day because the nurses can't because of the regulations.
Well, thank you, Dr. Wen, for sharing all your expertise and your personal stories. Thank you so much.
My pleasure. And feel free to contact me anytime if y'all have questions again. I'm on call 24/7 because I have no life.
Thank you.
Thanks. Y'all have a good day.
Thanks. Bye-bye.